Parfait, avec plaisir.
Good afternoon, everyone. How are you? Fine? Everybody is there? Thank you. For those who don't know me, my name is Marina Verbitsky and I'm Managing Director of Swiss Medical Gate. Thank you to join us today. We are really very delighted to see you, many of you, or some of you to see you back. This year, we dedicated our second webinar series to prevention and healthcare innovation in Switzerland. Today, we are starting with a very exciting topic. I wish you a pleasant webinar and I pass the floor to our Administrative Director, Ingrid. For those who will like to Ingrid?
Yes, I'm ready. Sorry, I just wanted to have the right page. Ladies and gentlemen, good afternoon and welcome, as Marina said, to all of you. My name is Ingrid and I'm the Administrative Director at Swiss Medical Gate. Before giving the floor to the medicine, I will shortly present you Swiss Medical Gate and give you some technical guidelines. Alex, our webmaster, is at your disposal if any technical help is needed. And Ina, our interpreter of the day, will simultaneously translate the presentation in Russian. Meanwhile, we will speak to you in English. You have the choice of listening to the presentation in Russian by clicking at the bottom of your screen. You have a button where you can choose English or Russian so that you can follow the language that you have chosen. Let me give you some details about Swiss Medical Gate. Swiss Medical Gate is an independent international medical coordination structure that has been in existence since October 2019, but whose general management has a background of over 20 years in the medical field. We are accredited by most of the university hospitals in Switzerland, private clinics, professors, and doctors of world renown. Let me explain how we could work together. Thanks to our multilingual case manager team, we will respond to your medical demand within 48 hours, and we will accompany the patient throughout his or her medical stay. To do this, Swiss Medical Gate will process your demand with the best specialist, send you the relevant quote, and if accepted, take care of all the administrative aspects of the patient's stay, such as visa, hotel, transfer, coaching, etc. The patient will be taken care of by the case manager from the moment of his arrival until his departure at home. We also take care of the medical follow-up of the patient after his departure home. If necessary and if needed, we work with interpreters accredited to our structure who are there to facilitate and ease the patient's stay. Our goal is to satisfy you, but above all, we are listening to the patient's request and make him our main priority, as do all the doctors with whom we work. This is the main reason of our slogan, patient first. We thank you for your attention and ask you for the smooth running of the webinar to switch off your microphone and your camera, please. According to your choice, you have the possibility to ask your question to the professor after his presentation, either in writing, either orally, please feel free to do so. I now hand over to our moderator, Dr. Michael Rabaeus, and wish you a pleasant continuation of webinar. Thank you.
Okay, thank you very much. Hello to everybody. I'm happy to be here today for what I hope will be an interesting webinar. My name then is Michael Rabaeus. I am a specialist in cardiology and internal medicine. And as I was involved for many years as medical director or in the director for several medical clinics and institutions that were in contact with foreign countries. So I've been used to taking care of people from abroad since very, very long. During these years, I have made a specialization in what I like to call health level assessment, or what you call usually checkups. And I am very much adamant about the importance of lifestyle, and it's not only preventive but even curative effects, and that's something that we will probably talk about. All this leads to the idea of better aging, which lies behind today's presentation. And it's a great pleasure through these things of better aging and especially lifestyle and prevention that we are now collaborating with Professor Dantoine, who is a very high specialist in these fields. And it's a great pleasure to turn over the word to Thierry, that you can now present yourself.
Thank you very much, Michael. Good afternoon, everybody. Thank you for Ingrid and Marina for the welcome, and to Swiss Medical Gate to allow me to share the view of a modern and efficient preventive medicine. I am practicing this specialty for years, and I will try to describe our specific and unique approach to preventive medicine, thanks to my background in different topics of the medicine. First, I would emphasize about the innovative personalized preventive medicine that is available now by using new technologies with artificial intelligence, and all the devices we can propose to the patient to have very exhaustive assessments to make diagnosis and follow-up and management, and to make the patient benefit from different specialties. And I really appreciate all the collaboration that Swiss Medical Gate can give to the patients, and to make a real coordination for the preventive medicine, but also for complex or multi-comorbid patients. I am professor of internal medicine, nephrology, geriatrics, and biology of aging since 2003. And I have a special focus on biochemical or functional biochemistry. I will explain what is how it is important in aging management, hormonal, vascular, chronobiology also, and immunological approach of the effects of aging. So I also worked on in the research field on the biology of aging and preventive medicine since 1994. Next slide, please. When we want to propose to the patient or to healthy persons an aging assessment or preventive medicine consultation, we have to consider that aging varies from person to person, depends on different factors. First, we all know that our family history and genetics is very important. And nowadays, modern medicine can benefit from predictive medicine. That means genetic tool, genes that can give us the opportunity to know how the patient can be predisposed to different diseases. And it's on the next slide, please, Ingrid. Yeah. These programs and this consultation also always include genetics and new and modern medical approach of preventive medicine. The second point that makes personalization of this approach, very important, is a lifestyle assessment. And it begins very, very soon in the lifetime, from teenage up to the late age. And this assessment we propose will include a very exhaustive assessment of this lifetime with nutrition, physical activity, but also environment, we'll see. And at another point is effective environment. And we know now the pandemic crisis, how much it is important to have the prevention of stress and how to manage stress and the effects of stress on aging and global health. So I would say personalization, personalized assessment is the major point of our approach to make a global preventive approach to patients in the cases of healthy person, but also in patients suffering from different disease. And aging is not a sickness, we all know. We all know that we age all. It's not inevitable, but we can delay nowadays and reverse aging functional effects, and that makes prevention an opportunity for everybody now. Next time. An important notion to understand what is aging is the functional reserves decrease along the aging. In these pictures, I show you the functioning of the body. It's a very important point to be assessed before talking about prevention or for medicine, but preventive medicine above all. You can see on the lower part of the figures the life ages from 16 years old, the age of post-puberty stage, when the total body and total body functioning maturation is okay, is done. Until the very late age, we all have different functioning level of the body and mind. During this lifetime, aging will decrease the functioning of the different organs of the body, and that makes us more difficult to face stress or acute disease. And this, what we call this natural aging on the yellow line, shows you this slowly but progressively decrease of these organs functioning. But even at a very late age, our body functions and make us completely autonomous and allow to have a normal life. But this decrease through the lifetime is different from persons as a function of their genes, of function of their environment, and this line, this slope, can be more or less faster, horizontal or vertical, as a function of these factors. And we'll see how we can assess this factor and how we can make a real good evaluation of what is real functioning age versus chronological age. And what is important on these figures is to see what are the functional reserve. The functional reserve is what you can what the body can take, the energy it can take to face stress and disease. And there's a state, a limit, a threshold where the body can face this kind of disease. And you need, when the imbalanced state is obtained, when the patient can't afford to face alone without any medication or hospitalization to face this stress. And the difference between the normal functioning and this situation are the functional reserve. And all the aging assessment or the preventive medicine assessment will focus on this assessment of functional reserve. It's very important. And as you can see on this figure, the functional reserve are decreasing progressively from teenage to very late age. And when the person faces an acute stress or disease as COVID, this natural aging line can be broken, and the functional reserve will be thinner, will decrease, and without any good medical management, the natural aging will be accelerated. And better aging is a better management, a better improvement of functional reserve. That's why we can say age can be reversed on that point, on the fact that your functional reserve can always be improved, even in late age, even with disease. So it needs exhaustive assessments, and I will explain you how we can do this. Next slide. So we have different levers to manage this functional reserve and aging, and they belong to different fields, and especially three fields: medical, psychological, and environment. When you assess a patient for his functional reserves and his physical age versus the chronological age, you have to consider all these three levels that will make us possible to advise and to make recommendation for the patient to better live, a better age, and slowly ages. The medical point, I told you that genetics is very important. We have now many innovative and innovant tools in genetic medicine that can help us to see the gene of the patient and the predisposition of the patient to have diseases or to have a lower functional reserve. The medical clinical assessment through consultation, during consultation, is very important and has to be very exhaustive on the functional potential and functional skills of the patients. Medicine also progresses, help us now to better manage the disease, to better diagnose also the disease, and new technologies offers us an opportunity to better assess these functional reserves and to make diagnosis as soon as possible to prevent disease evolution and aging consequences. So the medical point is very known, but it's all the tools as biochemical, parameters are not used enough in our in the current medicine, and we propose to our patient to have access to these new tools. What is functional biochemistry is just to measure the biological parameters that have a direct impact on function, not describing just a stage, a photo time of the level of this measure, but also these biochemical parameters are indicating how the body of the different organs can function. For example, we use in diabetic patients many of these tools, but in preventive medicine can be used before diabetes appears, and so to prevent all the consequences. So this is a very important point for the medical lever to act on personalized aging. The second lever is the environment. We all know that pollution, stress from different products, or the lifestyle as nutrition, as physical activity is a very important thing to stay in good health and to prevent disease, aging-related disease. And this environment has to be assessed during this kind of program of checkups or consultation, and can be very useful for the patient just after a simple consultation to make a prevention, aging prevention reality. And the psychological aspects are very important. So also in aging, we all know that very old patients or very old persons stay very young in their mind, and it has a real impact on the preservation of functional reserves of the body, and so in aging. And to take the example of the COVID crisis, we all know that the stress it has induced will have and has a huge impact on the global aging and the global health. So for these years of clinical and research practices, I could create a unique assessment for this aging approach and in preventive medicine. Next slide. So a very important point when we deal with aging and preventing medicine is the personalization of the assessments. Because aging varies from person to person, it depends on this progressive frailty. That's progressive reduction of functional reserve. And these impaired reserves can be managed by a good assessment using clinical assessment and biological and imagery, and above all functional test assessments. But it's also very important in patients suffering from one or several disease. And the complexity of multi-comorbid patient makes us face now the doctors to very complicated situations with different ways of impairment of this functional reserve. And we can act on, for example, on the heart and decompensating the kidney and the brain, etc. So the unique approach we propose to the patient in preventive medicine is applicable, is good also, and I would say it's very effective in these multi-comorbid patients. And the coordination of these cases is very important to have a global view and to prevent aging-induced frailty. Next, please. So our preventive medicine proposal implies this focus on frailty detection by the unique global health and aging assessment, which is clinical first and that can use functional tests. One is very known in sport medicine as the maximum oxygen volume consumption of the sportsmen when they are practicing sport is, for example, a very important preventive medicine tool to prevent to assess first the functional reserves of the person when she's practicing sport, but also to trigger goals in the management of their sportive performance. It's quite the same thing in the person that wants an assessment for the preventive medicine. To have this kind of functional test will give us the opportunity to assess what is the real physical age of the person versus his chronological age, and how can we help her to improve this and to reverse the aging process in this case. This uses innovative technological devices, and as functional biochemistry, using these tools make us very efficient in the functional reserve preservation and recovery in different cases in healthy persons as well as in multi-comorbid patients. And the second point is the personalized program. Thanks to these assessments, we can propose personalized programs. And I give you an example. We can of the kind of programs we can propose. The first is a very actual. It's a post-pandemic crisis recovery. It concerns all of us. It's not focused on patients who have suffered from COVID, but the whole population that is now suffering from the restrictions or in the daily lives we have to do to prevent the infection of from the COVID. It's inducing now a change in our physical activity, in our social relationships, in our stress, in our way of feeding, of the way the nutrition is made. It has been proven that the use of medication for the stress, the alcohol or tobacco use have exploded during this crisis. And now persons and patients need to recover or to prepare to recover from these changes and to recover good immune defenses and global health factors. So in this specific program, we propose a reboost of these problems, and I think it's now the time to think the post-COVID pandemic crisis and to propose this kind of approach. So it includes checkups and management of these the frailties that have been induced by this change of lifetimes induced by the COVID pandemic. The second program is the weight management. The weight management means that definitive for the patients or the persons how to manage a weight. And our knowledge in chronobiology is a central part of this one advantage, because with chronobiology, we know that our body secretes different enzyme, gut enzyme and hormones, different at different time and differently at different time of the day. So eating the good food, the good type of food at the good moment is a key point to better weight management. And that's what we propose to the patient that want to have this to have this kind of program, is to modify, to adapt their nutrition as a function of the chronobiological rhythms. We also add the intermittent fasting diet for the boosting phase of the loss of weight that has been proven. This intermittent fasting being the most long-term effective diet to lose and maintain the weight after the loss of weight. We also use new technologies to prevent the effect, to prevent, for example, abdominal obesity with new presotherapies, and that will decrease the deep fat around the pancreas that creates insulin resistance and obesity and cardiovascular disease. So during this program, it's a very global and large program to manage the weight. We also proposed personal programs on multi-comorbidity management. As I told you, it's a very complex case management in medicine, and we have the expertise to propose really very good programs in this field. Another point is my approach to my knowledge is in nephrology and all the management of blood and blood purification. We can propose toxin purification through IV infusions. I will explain further how, and also new techniques, apheresis, which are techniques as dialysis, that can make you withdraw cholesterol or toxins from the body as dialysis. And another very important point is the follow-up and personalized follow-up, as focused by Ingrid. Swiss Medical Gate and the collaborative doctors can provide a very good and personalized follow-up, because in preventive medicine you can have a recommendation during one visit, but the patient will apply more or less the recommendation, and the follow-up is very important to have this motivation and also to adapt the follow-up to optimize to the recommendation we made during the first consultation or the first checkups. So that's a very important point also for us to be able to propose this personalized follow-up. Next, please. So how can we do this age reversal, this slowdown of functional reserve or age-related functional reserve decrease by frailty detection? We can do this through consultation, and we have a regular consultation and a very complete and global consultation with we have called age reversing preventive chronobiology. It's a very long consultation of 1 hour or 1 hour and a half, where we can make the point about all the history of the patient, the family history, but also his functioning through the clinical examination and through the assessment of its nutrition, its chronobiological reasons. For the sleep, for example, it's very important also in the preventive medicine. So these consultations are very complete and can make us provide our unique approach of the preventive medicine. The second, also very important and specific consultation are the global health issues coordination. It concerns patients suffering from one or two or several diseases, and that want also to be properly follow up by coordinating the whole medical recommendation the patient can have from different specialists, because many patients say and are aware of the difficulty to make the global integration of what all the doctors can recommend to them. So we can help them because we have the knowledge to better manage a global health and personalize the global health. So that's a very good specificity. Then, thanks to our different specialty, we can provide nephrology, cardiology, diabetes, immunity, and internal medicine for diagnosis, for treatments, and for preventive medicine. We can also provide follow-up consultation through by teleconsultation if the patient is outside Switzerland, and we propose also file expertise when patient wants second or third medical devices, about diagnosis or treatment. They have been proposed by other centers or by other medical expertises, and that is really interesting to apply all what we talked about our global approach, because our expertise would also integrate all what I described before. And maybe Michael, can you talk about the consultations? Yes, also?
I'd like to make a comment at this stage, because I think it's extremely important. Thank you very much, Thierry. It's remarkable. And I'd like to underline this very important fact that the whole process of checkup here is really to determine the global state of health. And let's keep the word health always, because it's what we need, we try to get back to. And of course, from time to time, you do find during these checkups an underlying disease that had no symptoms, but most of the time, there is nothing serious going on from a disease standpoint, but from global health and from accelerated aging process. That's something that can be influenced by the checkup. That's why it's very important to really to include in the health level assessment all these factors of biological health and what can we do to improve on that. I'd like also to underline that, of course, from time to time, unfortunately, you do find something underlying that is not yet causing any symptoms. And this must lead to the choice of an appropriate treatment. And it's something we are very, very adamant about, is that the treatment must be in the interest of the patient. That's very important. And one must remember in that aspect that if a patient has no symptoms and you have to give him medications that have side effects, you have to be very convinced, and it has to be, as I said, in the patient's really true interest. I just wanted to make that comment, and I'll turn back the word to Thierry.
Thank you very much, Michael. Next slide, please, Ingrid. So we can propose different checkups, just biological, but as we use functional biological parameters, it can be very, very effective also for first checkups and global checkups, including biological parameters, imagery, and functional tests. And that makes our strengths to propose a real preventive medicine. And we have different levels of biological checkups and global checkups. The first one is the Preventive Biocheckup, is very complete for the first approach of the global health of the patient, with lots of functional parameters, about 60 parameters, and it will lead to a first step preventive medicine recommendation program, follow-up and program. The premium is more complete on cardiovascular risk disease, cerebrovascular disease, and nutrition. And it can be an option, include also genetic tests that are very innovative, because they help, as I told you, in predictive medicine to manage the prevention and the functional reserve preservation of long-term lifetime preservation. And the perfect is a very complete checkups with additional parameters about cancers and neurodegenerative disease, because progresses in medicine now gives us ways to have good preventive actions, even in neurodegenerative medicine. So I think it's a very important value that we can have with this kind of checkups. And the global checkups are on the same step checkups with the innovative devices for the functional test and with imagery. They can be detailed in the documents that the Swiss Medical Gates will give you. Next. We have this checkup, but also programs, and age reversing programs aim to improve this functional reserve and the age related disease risk decrease, and we can have treatments programs, as I told you, with infusion or blood purification to correct correct aging accelerating factors as oxidative stress factors, autoimmune inflammatory factors. And this is included in intravenous infusion programs with the three steps anti-toxic revival. This program will first focus on elimination, withdrawal of toxin from the body. The second will protect the cells with antioxidation and anti-inflammatory products. All are natural derivated products. And the last step of these infusions concerned regeneration, that is the adaptation of oligo elements, vitamins, and all what will make the cells stronger to face the future stress. And the blood purification program is a nephrology treatment for specific problems, but also for toxin withdrawal. It's plasmapheresis that use filters. We filtrate the blood to withdraw bad inflammatory or toxins from the blood. And new techniques is now available for cholesterol withdrawal with apheresis, with the special filters, and it's particularly indicated in patients with high cholesterol and that can take or who don't want to take treatments for lipids, cholesterol lowering, and we'll all know the side effects of these treatments. So other programs can be done through cares, longer stay, the post-pandemic crisis recovery with immune and antitoxic booster care. It will include checkup. It will include this approach with infusion, this how to improve the functional reserve during the stay of the patient, with physical activity recommendation, with how to modify the nutrition also, but focus on the immune defenses and the liver, lung, and kidney toxin elimination focus. Another program is the age reversing booster care. It's a larger one that will go to the more global preventive medicine, not just on immune and antitoxic booster. The weight management care, I talked you about our approach. And another very interesting possibility for the patient is the program à la carte, adapted to complex multi-comorbidities. The patient will give the file, and the Swiss Medical Gate and the different specialists will build a program to address specific issues and global management of these issues of these complex patients. But it's also very good for preventive medicine in healthy persons. But with this approach, we can really improve the global health and make prevention even in these multi-comorbid patients. That was all what I wanted to propose, and would be happy to answer to your question now.
Thank you very much. And really, that was a very complete and interesting presentation. And I hope and I'm sure that there will be some questions from the audience.
Ingrid?
Marina, can you check if there is any question? Because most of it, they're all written in Russian, so I cannot help. On my side, do not have anything. But
I would like to have a question.
Sure, sir. Go ahead.
My name is Andrei. I have 3 questions. Thanks a lot for your impressive presentation and for such a great description of the main pathways of the aging, which is completely associated with a kind of multiple diseases. I'd like to ask you, and would you be so pleased to list namely the main toxins that will be removed from the body with your procedures, like let's say above mentioned specific boosts and maybe additional apheresis.
Yeah, so thank you for your question. The first is to reboost the liver and kidney elimination of the toxins from glycated products. You know, aging is associated with glycation. That means that the sugar is captated by proteins, and that's also provoke an inflammatory acute inflammation of the body. So these toxin can be better withdrawn by the liver with this kind of infusions. It's the same as in there are many natural products that also can be taken by orally. And so it's to answer to your question, it's a glycated protein. It's also all the inflammation induced proteins that if your liver function better, and the kidney also, but it's less known for the kidney, by activating enzyme from these organs will help you to eliminate these inflammation induced proteins. We also have a special program for heavy metals. You know, heavy metals are very toxic for the brain and normally the kidneys can eliminate properly the heavy metals, but with the nutrition, for example, fishes with arsenic or mercury, we can accumulate this kind of heavy metals. So we use pharmacological chelators to withdraw these metals. We also have autoimmune antibodies for specific pathologies, for example, for the thyroid pathologies or for the joint inflammatory disease. This plasmapheresis can be used. And for the cholesterol, it's a technique that is most used in very specific familial hypercholesterolemia, but we propose to the patient even in preventive medicine because we know the technique and we practiced it, you know, in France and Switzerland before. Yes, and so that's apheresis, you know, it's like blood purification through a filter with a special pores that can make you withdraw LDL and VLDL cholesterol.
Okay, thank you so much. And will the patient or the doctors that will support this patient with your techniques and with your modalities, will the patient see any kind of changes with its blood? So do you check any kind of heavy metals or other toxins in the blood before procedures and after the procedures? And
yes.
Is it enough 3 boosts or 7 boosts, for example, for removing all the debris, all the toxins, and all the non-used particles?
Okay. Yes. For example, the heavy metal, it's the simplest because we can measure before and after. and so we can see the decrease of this metal. We have to do it 41 day after the end of the chelation. We can test at the end, but it's better later to make the chelation active, to be active. In the preventive, as I described to you, the bio checkups, even in the premier level of the biological checkup, we measure the glycation and DNA markers that are related to the toxin action on proteins and sugars, and we can control this the effect on these glycated or inflammatory stress oxidative damaged proteins. We measure them. Yes.
Okay. And would you be so pleased to continue with the kind of achievements that these methods or these patients that will be undergone this kind of treatment will have at the end of their procedures? For example, energy level, which is calculated somehow through the scales, or maybe some improvement in their main biological parameters, or maybe, let's say, 6 minutes walk distance, and whatever you could imagine about this kind of calculated improvement.
Yeah, that's a very important point in our programming checkups. That's the real plus value to have this specific test, to have the first assessment and the follow-up. And we use the calorimetry to assess the basal metabolism and to show how these calories burn is made from proteins or from sugar, and then we can recommend to have more physical activity, or on the contrary, to have a calories restriction to have this prevention or this weight management. So we use this kind of tests, calorimetry. We always, Dr. Rabaeus can talk about the ECG and effort. We use maximum oxygen volumes that are very good tools to see the functioning of the body through physical activity, and it's a good marker for the physical age versus the chronological age. We also use markers, biomarkers, as you say, for the markers for the insulin resistance. We also for the oxidative stress, for the I can give you an example for the coagulation and risk of stroke, cerebral thrombosis. So we have innovant markers, or very known markers, but that we use in the preventive approach, because many tools exist for disease management, and it's a pity, but it's very effective in preventive medicine. So, and most of central doctors don't know how to use this tool to the follow-up.
Okay, and the last...
I'm very sorry. Just we have another questions. Okay. If it's possible, maybe to write to us, and we can also organize some meeting, personal meeting for you, Andrei. Okay. Yes. Okay. Yeah, because we have another person. I have a question, Professor. How do you feel about homeotherapy?
Homeopathy.
Homeopathy. I'm sorry.
Homeopathy.
Yeah. Yes. I haven't talked about this approach, but it's always a good point. Thank you very much for this question, because our approach is global. So for the preventive medicine, frailty or functional reserve assessment can be usefully more precisely made, also using this approach of I would say more oriental or energy medicines or tests or assessments are also for the homeopathy. In preventive medicine, we can have a very good impact of this kind of treatments, because it's based upon I don't know the English term, but I would say it's the field treatment, how you can manage the frailties of the patient by improving them before the disease, by treating the field. There are different profiles that homeopathy can assess, and it can be very useful. And we work with also practitioners that are specialized in this kind of treatment, as well as in acupuncture or Chinese traditional medicine. That's so. To answer, I think it can be a very good complemental way to make prevention and to manage functional reserve decrease with aging.
I agree totally with that, and I do actually work with several homeopaths, and I think it's just important that one should group together, and sometimes they have some very interesting, and they are very much interested also in the fact that we are not pushing to necessarily long-term chemical treatments, allopathic.
The same gentleman, Vladimir, is asking for another question. Is Eastern medicine applied?
We can for the patient wanting a complementary treatment or assessment. Yes, we can do that. I don't do it personally.
Okay, then we have Vladimir had another. Okay, thank you. Vladimir has other question, but we will get to him particularly because it will be easier to put everything, having the program prices by email. Mr. Sokruta, I'm pleased to welcome you back. Actually, it's nice to hear from you. He's asking for use or have heard of ozone therapy.
Yeah, ozone therapy is a treatment to also fight against what we call radicals, oxygenate products. I don't use this practice. I don't. But it's a way of. I would say it's a way of antioxidant therapy, but we use other ways with our infusion or with the global treatments we can propose. But well, I don't have expertise in ozonotherapy.
Do you want to add something, Dr. Rabaeus?
Well, I could just, when it comes to free radicals and oxidative stress and all, I know I very often maybe repeating myself, but one of the most potent actors against free radicals is regular physical activity, which has been shown very clearly to take down the free radicals and oxidative stress.
Thank you. We have another question from, unfortunately, I don't know whom. May we be addressed to any publication devoted to reported topics, and would you list any randomized trials that describe mentioned approaches and achievements?
In preventive medicine, it's very difficult to have randomized studies as in the treatments of specific disease. But we have all what we propose to the patient are evidence-based medicine through biological research first, then by testing in the population. But we can't say we have randomized study about everything we do. But the whole medicine doesn't either. So, but it's a very good question if we use special treatment, we can give the publication, but for the whole treatments in preventive medicine, it's not done just for financial problem, because it would be very long to assess, but we can have many important information through the 40, 50 years or 40 or 30 years past 40 years studies for cohort studies that can give us very interesting publications about what we propose to the patients. But randomized studies, it's not possible for everything. It's not available.
I have a suppose last question in two parts. Is it possible to find out which infusion media are used in therapy?
For the, I don't understand what the question wants to. So can you repeat, because I
hold on.
They want to know the products.
No. Which I suppose so. Yeah, because now there's a fairly large range of vitamins and dietary supplements. Which vitamins do you use in patients?
We use the vitamins as a function of the checkups. We use the biological tests very precise. We can assess which kind of vitamins the patient needs. It's a personalized treatment. So we can use all the vitamins as a function of the need of the patient. What is very important with vitamins is to know the global health state of the patient, of the person, because there are vitamins that have been proven to be dangerous. For example, say I don't want to say you don't take any vitamin E, but when you take vitamin E, you have to be very careful about your tobacco consumption, about the association with beta carotene with that. So what we propose is a personalized assessment, biological and with the pathology. That's what are very important, but all the vitamin can be used.
Dr. Rabaeus, can you read the last question? I don't get it. I'm not sure that...
Yes, we do not have randomized controlled trials. Maybe you will address us to some definite articles. Well, I agree with Thierry. There are lots of articles, and yes, we can certainly take out a few, but it's true that the randomized control are very difficult, because you are right in the question also, because I take very often as an example, it's very difficult to tell somebody to exercise, but to make somebody exercise, but to tell him it's only placebo, who is resting, it doesn't mean anything. So you cannot make somebody exercise without him knowing it. So that's why lifestyle and some supplementations are very difficult to, but we can certainly make a little collection of articles.
I think there is no more question. I don't see any more. If there's anyone who wants to talk, please do so. For the ones who have any requests regarding the programs and the prices, we will be delighted, Marina or myself, to send you everything by email. It's easier for all of us. So I think that if there is no other question, we would like to thank you very much for your participation. I'd like to thank you, the ones which we haven't seen but are behind. So Alex and Ina has been very helpful. Professor Dantoine, Dr. Rabaeus, Marine and myself, we would like to wish you a nice end of the day, afternoon, night, wherever you are in the world. And looking forward to see you in our next webinar. You will receive, as usual, the information giving you all the details.
Thank you very much. Thank you for being with us. We will keep in touch. We will inform you about our next seminar in April. All the best.
Thank you to all of you.
Bye.
Bye.
Thank you. Bye-bye.
Bye.
Thank you.
Bye.
Bye.